We earlier on made introductions to the concept of what ectopic pregnancy. Now we said ectopic pregnancy is any pregnancy that is what out of the what endometrium. All right, note that the endometrium is high up here. All right, the baby is to implant this side or this side. Now there are different places that what a baby could miss the target then implant. You understand? So this one is known as what the interstitial or cornua ectopic pregnancy. So the baby is implanting here instead of here. You can see that it's here that is a correct pregnancy. Do you understand? So the baby is what implanting in a different place. All right, and there are different places that the baby could implant, but we are focusing on this particular place known as what the interstitial or cornual pregnancy. So it's a potentially life-threatening form of ectopic pregnancy. Ectopic pregnancy, the baby is planting out of what the normal place is supposed to plant. Okay, so it occurs when a fertilized egg implants in the cornual region of the uterus. All right, specifically within the interstitial part of the fallopian tube. That's why they just call it cornual pregnancy or interstitial ectopic pregnancy. Okay, so this is the portion that passes through the muscular wall of the uterus. Now the location makes it distinct from the typical tubal ectopic pregnancy. Now to tell you that if a baby misses this place, most of the times it implants within the fallopian tube. Do you understand? But this one, it just implants before it gets into the fallopian tube. Right? So why it is dangerous is this area is highly vascular. That means the blood supply is so much. It's surrounded by uterine muscles, so it allows the pregnancy to grow longer. Like, because this place, it has less problem. Before you can dictate that the pregnancy even implanted in a different place, if you are not monitoring the woman on ultrasound, it will take a very long time. Maybe the baby has developed to some greater stage before you can discover it. Okay, so when it ruptures, it can cause massive bleeding. This is because a lot of blood supply is around that area. Okay, but it's less common. All right, accounts for just 1% of ectopic pregnancies. All right, so symptoms is the woman is missing her period, pregnancy test is still positive, her breasts are tender because hormones are rising and all of that, them estrogen. Advanced emergency symptoms is what? Pelvic pain, vaginal bleeding, severe abdominal pain, dizziness or fainting, shoulder pain too. All right, so diagnosis is what? Ultrasound. You are doing some imaging to look inside and confirm that this baby was not in the endometrium. All right, then MRI or CT scans, all those ones will still confirm. Right? And we're not saying you should do all. One could just be enough. Okay, treatment is what? Surgical intervention, like they remove the baby. Okay, in some cases, if you don't want to remove the placenta, you can give what? Methotrexate. Okay, the medication will stop cell growth and will help the body to reabsorb the cells that are left. Okay, it could be the whole embryo, it could be just the placenta. The body could actually reabsorb the embryo. That's in early stages. All right, so early diagnosis is key for this.